Welcome to today's deep dive. We are jumping into this Altisima Advisory Playbook on life sciences sales enablement in 2026. And the mission today is grabbing practical takeaways for you, specifically if you are a VP of sales in this space. Because, imagine running a team where a single outdated slide doesn't just lose you a deal, it lands you in federal court.
Right, the stakes are just astronomical.
Exactly. You're dealing with what the playbook calls the regulatory intelligence gap. The FDA approved like 55 novel drugs in 2023 alone. Clinical evidence is evolving nonstop. So running this kind of sales team feels a bit like flying a fighter jet while the engineers are, actively rewriting the flight manual midair.
Yeah, and the whole system completely breaks down on the speed of those manual updates. Right now, something like 60% of companies take over 4 weeks just to distribute updated promotional content to their reps after a label change.
Wait, 4 weeks? That is a lifetime in sales. In standard B2B SaaS, you just push a new deck to the cloud and you're good to go.
Exactly, but here, every single piece of content has to pass MLR, medical, legal, regulatory approval. And that cycle alone eats up, 10 to 20 days.
Right, because every claim has to be totally airtight.
What's fascinating here is that the risk profile is entirely different. If a life sciences rep uses an outdated claim, you aren't looking at a lost contract or a PR headache. You're looking at potential Department of Justice enforcement.
Oh, wow.
Yeah, actual criminal charges for misbranding.
Plus, the enablement team is dealing with massive friction when building the content in the first place. You can't just whip up a generic ROI calculator. Because you're selling to clinically trained HCPs, they demand randomized controlled trials, not just marketing fluff.
Which means the tech infrastructure has to be highly specialized. For a VP of sales, you need a system built around claims substantiation. Like every single promotional claim on a rep's iPad has to be hard-linked via metadata to specific FDA label text.
So it's essentially a compliance vault.
Yes, precisely.
So if the underlying prescribing info changes, the system uses that metadata to trigger an automatic kill switch, right? Like just instantly locking or wiping the expired claims across every device.
It has to function exactly like that. And that offline mobile access comes with strict, no local editing rules. A rep absolutely cannot be allowed to tweak a slide on the fly.
Right, because a rogue edit completely bypasses the MLR review process.
Exactly.
But wait, that strict lockdown makes total sense for avoiding federal court, sure. But it completely paralyzes a rep who suddenly needs to pivot their pitch. 1 minute they're talking to a clinician about strict oncology guidelines, and then next they get pulled into a meeting with a pharmacy committee to justify the budget impact.
Well, that's where sophisticated stakeholder playbooks come in. The vault can't just be a static library. It has to instantly surface the right pre-approved narrative for the specific audience the rep is facing.
Without requiring any manual adjustments.
Right, zero manual adjustments.
So if the main bottleneck is that 20-day MLR approval cycle, I feel like the immediate temptation for a VP of sales is to just throw AI at the problem. Right? Just use AI to generate claims faster.
And that introduces a massive compliance trap. The 2026 EU AI Act explicitly categorizes healthcare AI as high risk.
Oh, right.
You do not want a consumer-grade AI hallucinating an unapproved off-label claim during a live pitch to a doctor.
So AI is just completely boxed out of the customer-facing side.
Pretty much. But if we connect this to the bigger picture, you don't just ignore a tool that fast. It's incredibly valuable for internal processes.
Like back office stuff.
Yeah. AI accelerates literature triage, it aggregates account intelligence, drafts call plans, it speeds up the internal drafting process significantly.
But human MLR review still governs the final output. Like the AI organizes the raw data, but a human stamps the approval before it ever touches the iPad.
Exactly. The competitive advantage in 2026 goes to the VP of sales who closes that regulatory intelligence gap. It's all about empowering reps to discuss brand new clinical evidence within days, not weeks, while keeping everything strictly compliant.
Right, maintaining scientific credibility at the speed of the market.
But, as you navigate this space, consider this. As AI models inevitably become capable of instantaneous, flawless MLR compliance validation, will the future life sciences sales reps still be an educator? Or are they simply going to become a human liaison managing the AI that actually educates the doctors? If we're flying a fighter jet while the manual gets rewritten mid-flight, maybe the next step is the AI flying the jet altogether, something to mull over as you build out your own playbooks.